Hi to everyone. My name is jackielou from Ncma Ms. Trainees. Now I would like to share the 10 qualities of a caregiver and some images of attitude of a caregiver. Number 1, patience. Patience if you're looking at how to become a care worker. Patience is, of course, when dealing with patient and serving users with diminished capabilities, sometimes they may be slower at moving about or explaining what they need. They may also be difficult or frustrated prone to taking that out of their career. Remaining calm and patient no matter how stressful the task at hand may be truly skill of irritability can affect a care worker's ability to their job can of course upset patient. Number 2, Cheery Demeanor. Cheery Demeanor is the way you behave with people, an impression of your characters and feeling calm and cheerful. Number 3, multitasking. Multitasking refers to the ability to manage time and responsibility once by focusing one task while keeping track of others at the same time. Number 4, being to think quickly. Being able to think quickly is faster thinking can enhance skill problem solving and ability to stay focused on tasks. Number 5, punctuality. Punctuality, this is especially crucial when working in home care capacity because often those receiving care provision if a career is late it can be destructive or disappointing and maybe even impact on the level and amount of care that person receives if their time is restricted. Number 6, willingness to learn good. Willingness to learn good careers are never satisfied with their level of training ability. They always want to learn more. They do and provide the best care possible. Number 7, being a good listener. Being a good listener is always strive to fully understand what others want to communicate, particularly when the statement lack clarity. Number 8, kindness and empathy. Is the intellectual identification of the thoughts, feelings, or states of another person, while kindness is states of being kind, capacity to understand another person's point of view of the result of such understanding. Number 9, willingness to go extra mile. Willingness to go extra mile is important principle of success in all walks of life and in all occupation. Willingness to go extra mile, which means the rendering of more and better service than that for which is paid and going with a positive mental attitude. Number 10, being able to take responsibility. Being able to take responsibility if you have a responsibility for something or someone, or if you are responsibility in your job or duty to do them, to take responsibility decision relating to them. This is the meaning of 10 qualities of a caregiver. Thank you for watching. Bye! Hi to everyone. My name is jackielou from Ncma Ms. So now I would like to show you how the patient transferring from bed to wheelchair. First step need to do is perform hand hygiene.
Perform hand hygiene, hand wash.
And the next, provide privacy complete. Explain to patient what you are doing so the patient is aware. Before standing the patient, make sure the wheelchair is placed next to bed, facing head of bed or foot of bed. Before standing the patient, make sure both wheelchair footrests are folded up or remove your wheelchair for safety. Before standing the patient, make sure it's the best slow position. Before standing the patient, make sure is the wheelchair is locked. Before standing the patient, give the patient, then directly explaining when they should stand with an agreed upon the count, informing them when to do. Stand in front of the patient, so maintain safety of the patient. Then count 3 of agreed upon. Count to inform the patient on when it's time. On signal, help the patient by holding it upward, position blocking client lens of stability. Help the patient to in front of wheelchair with backless touching wheelchair. They slowly help the patient sit in the wheelchair. Make sure the patient are sitting back of the wheelchair and the patient is upright position, then remove transfer. Place the patient feet on footrest. Make sure call signal in reach to patient. Good day to everyone. My name is jackielou from Ncma Ms, Nurse Caregiver Management Alliance. I would like to show you how to bath a bedridden person. Taking a shower bath is an important daily routine to keep us clean and comfortable, especially in a humid environment. But for people in a bedridden, they need to take a bath in a bed with the help of a caregiver. In this video, we will show you how to bath your patient and attend to their hygiene needs. Before starting the bed bathing, please all the windows and turn off the fan, and all conditioner is turned off to prevent chill. Before bed bathing, wash your hands thoroughly. Let your patient know that you are about to bath him. Hi Oscar, I am going to bath you now. I will clean your mouth and face followed by the rest of your body. Before starting the bed bathing, gather your materials to give a bath your patient. You need the more face towel and 3 more towels and 2 basins. I assume that I have 2 basins, but I have the 1 basin here. This one. And then the soap and also the lotion. And if the patient is not handled to brush her teeth, you use the soft wax sticks. If the patient is he handle how to brush her teeth, you give the toothbrush and give cup of water to rinse her mouth. And then now we will do the bed bathing. So now I will put the towel under her chest. I assume that I will remove the dirty blanket. So this one, the towel one. And then now, first need to do is wash her face. I take the face towel and then I rinse. I do like that. Wash the eyelid starting from the inside and moving out. So, need to do first is use the other side. Don't use the completely. This one. I'll do like this. And then I will do the other side. Do like that. After the eyelid, needs to rinse the face towel. And the next. Wash the face, ears, and neck. While do the wash face patient, you tell to your patient that participate the activities. Here the neck, the ears. Use also the ears that have dirty here. That. After completely wash her face, you do the dry, pat dry. I assume that I put a pat dry here, but here I will take this one. And then next, I rinse the towel, the face towel, I'll do again. for use for the arms one at a time and then the hands. Before starting the arms, put a towel there and under the head to prevent the wet. And assume that I put here. And I wipe. This is my hand of my patient. Are you okay, Oscar? I wash your hand. And also the next is the armpit. After wash the hand, you do the pat dry. And do also the other side, the same way. Then I rinse the towel. And then next, wash the chest and belly, including the belly button. This one I will do. After wash, we do also the pat dry. And then rinse again the towel. And then next, wash the one leg and then the other side. Wash the feet and in between the toes. This one. I will bend the knee. This is the back of my patient. After wash, we do also the pat dry. Then do the vice versa. I rinse again the towel. After cleaning and drying your patient, the next step is change him into clean clothes. Before undressing your patient, inform him what you are going to do. Oscar, I will undress you now. I will change your clothes. It's okay for you? Assuming that I remove her dress. Then next, after everything is done, we will do the back. And then help the person roll on his whole side so can wash the back side. So now, Scar, I will do your side. Slowly, slowly. I will do her back side. I take the face towel to rinse again. Using a new face cloth, clean the genital area first and then the anal area. This one. This one. After wash, do the pat dry. Check also if he have the allergy. Apply body lotion to protect the skin and keep it from become dry. Help the person as needed to finish the dressing. After his side, you do also the other side. After done everything, put away your supply and wash your head. Make the patient comfortable. And I'll do also the record observation and report anything as usual to nurse or supervisor. Take note, linens are usually changed when the bed bath is complete using the procedure of occupied bed making. Thank you for watching. Pleasant good day to everyone. My name is jackielou from Ncma Ms, Nurse Caregiver Management Alliance. I'm here to demonstrate how to clean and sterilize feeding bottle of baby and proper way of burping of baby. Sterilize helps protect your baby's immune system. First step need to do is hand washing. Assuming that after I wash my hand, this is the assuming feeding bottle. Now have the unused milk needs to discharge. Discharge the unused milk like that, and then rinse water before use the soap. After discharge the bottle, use the warm water to wash the bottle as well. This one, the warm water assuming. And this one, the soap. Put a little bit. And then you must brush properly the whole bottle inside. Like this. Like that. As we check the bottle if have it milk the bottom here. Then avoid the baby stomach ache. That's why we need to brush, clean, wash bottle. The same wash the other one like this. Like that. Brush properly. Okay. How about this one? The cover must use this one to do like this. Brush, brush, and then move around. This one. Must be always check here if have residue milk. This one the assuming of cover. After clean the bottle, you rinse the bottle in water. I'll do this one. Hi, this is the proper way of burping of a baby. Like this. You give milk to baby like that. After feeding the baby, you must be the burping of baby like this. The chin is over to my shoulder like that. And always put a towel for avoid the vomiting like that. Do like this. 1, 2, 3, 4. After burping the baby, have another way how to burp the baby. You like this, put the sit down like that, like this. The chin is you must do like that. Do like that. Assuming this is the baby, do like that. In the chin like this. 1, 2, 3, 4, 5. After burping the baby, you put in a crate. Slowly like that. Assuming that I put already the baby in the crib. After that, you must wash your hand. Thank you for watching. Bye. To everyone, my name is jackielou from Ncma Ms Trainees, Nurse Caregiver Management Alliance. I'm here to demonstrate how to infant bathing. So now, first need to do is inform the parents about procedure. Check the air conditioner and fan and close all the windows to prevent chill. Ensure properly lighting and privacy as necessary. And then, before touching the infant, baby must be hand washing. Assume that I'll do already the hand washing. Before starting the bed bathing infant must be gather all materials. Here are the materials. I have a basin. Assume that I have a 2 basin as well. The clothes, the towel, the cotton balls for soap, and diapers. Now, before undress the baby must be check the body temperature. The normal temperature of baby is 36.5 degrees Celsius to 37.5 degrees Celsius. And then next, check the temperature of water. If this one is 37 to 38 degrees Celsius, you must use the elbow to check the temperature of water. Okay, alright? And then perform the procedure. Remove the baby clothing. This one. Assuming that I remove the cloth of the baby. First need to do is wipe the eyes starting from the inner outer canthus to outer canthus using the clean portion of the washcloth. I'll take the washcloth and rinse. And then I do like this. Wipe. Slowly wipe the eye of baby. Inner canthus and outer canthus. After wiping, the eye of the baby must be pat dry. Slowly do the pat dry. After eye is next is wash and pat dry the face using the S technique or number 3 technique. Always wash the washcloth. Do like this. And then wash the face using the S technique. Good day to everyone. My name is jackielou from Ncma Ms, Nurse Caregiver Management Alliance. Now, I would like to show you how to occupy bed making. First need to do is introduce yourself. Hi sir, I'm Jackie. I'm here to change your bed. May I know your name, sir? Oscar. Okay. What is your birthday? Okay. Thank you. Have 3 identifier. Introduce yourself, verify and explain what you are doing, and then the patient is aware. Now, assuming that I wear a PPE already and wash my hand and wear gloves. So now, let's do the complete privacy as well. Okay? And then, I'm start now to change her bed. Ang una ko pong gagawin ay tanggalin ko po itong blanket niya. So now, kukuha po ako ng malinis na blanket. Ito po. Bago po tanggalin ang blanket niya, ay kailangan po natin untap yung nakatap-in. Kasi po yung mga gilid ay nakatap-in po sila. Lalo na po dito sa part ng may talampakan. Nakatap-in po yung blanket niya. So now, bago ko po tanggalin yung nasa ilalim is mag-ask po tayo ng favor dun sa patient if kaya niya pong hawakan yung ends ng linen. If hindi niya po kayang hawakan yung ends ng linen, isiksik po natin itong malinis na blanket dito sa may shoulder niya. Ganun po. Para, in case po kuhanin po natin yung nasa ilalim na blanket, hindi po siya matatanggal. At we do the privacy as well to the patient. Okay? Ganyan po. I-roll po natin. I-roll. Ang pagtanggal po ng blanket na sa ilalim po pahila po pababa. Pahila po pababa para po yung blanket niya hindi po maalis. Ito po. Ganyan. Ganyan. After po makuha yung maduming blanket niya, ilagay po natin sa hamper. Okay? Sa gilid. Yan po. Good day to everyone. My name is jackielou from Ncma Ms, Nurse Caregiver Management Alliance. I'm here today to demonstrate how to proper way of using vital sign. First need to do is you need to wash your hand completely. And then next, gather your materials. Assuming that my materials is already here. And then I need to introduce first myself to my patient. Assuming this is my patient. Hi sir, I'm Jackie. I'm your caregiver today. I check your vital sign. It's okay for you? Okay. May I know your name? Oscar. What is your birthday? Okay. Anything pain? Okay. After verify the patient, explain what you are doing to so that the patient is aware. Sir Oscar, I check your vital sign. First need to do is your blood pressure. I check your blood pressure if it's normal. So now we will check his blood pressure. Okay, this is the cup. This is assuming my patient. So that I will put the blood pressure cup. Assuming that me and my patient is properly of position. So now I will put this cup not too tight or not too loose. Ask the patient if tie the cup, and then you are know what to do. Okay, this one like this, and then the gauge is put here. After use the stethoscope, check first if it's working. You do like this. You knock. Okay, it's working. Okay, and then after that, the stethoscope is put under the lid of the cup. This one, like this, and then tie the screw. This one. After tie this one, pump until 180. The normal rate of blood pressure is 120/80. The first sounds that you hear is that one, the systolic, and then the second one is that one is diastolic, and then after that you lose slowly, and then after that you check the gauge. Oscar, your blood pressure is normal. After checking, the blood pressure must be put in a record quickly, and then you not forget. After checking the blood pressure, next in temperature. The normal of the temperature is 36.5 to 37.2 degrees Celsius. Assuming that my hand is clean. So that we will get our thermometer and put in the underarm to your patient. Okay, and then wait until a few minutes. Okay, I'll put here. Assuming that I will put it, I check in my watch. Okay, then your temperature is normal, so that you must be list down. And then next, use the blood glucose. Before use this one, the blood glucose, you take the cotton balls with alcohol to swipe in his finger. So I need to Insert his finger. And then, assuming that I already put the needle inside. This one. Okay? And then, put number 3. After the blood is come out, use this one. And then put here the blood to check the rate of her blood. Okay, so that's one. Okay, your rating is normal. So after checking, you must list down. And then next, the pulse rate. The pulse rate is, you take the 2 fingers, this one, put here. The normal rate of the pulse rate is 60 to 100 per minute. Okay? Okay, after taking the blood sprays is you must be list down. Okay, this is the use of the vital sign. Thank you for watching. Good day to everyone. My name is jackielou from Ncma Ms Trainees, Nurse Caregiver Management Alliance. I'm here today to demonstrate how the proper way of NGE tube feeding. First need to do is gather your materials. Next, perform hand hygiene. Assuming that I wash my hand already. Provide privacy. Before I starting the procedure, I introduce myself and verify the patient ID and explain the procedure, what are you doing, and then the patient is aware. Hi sir, my name is Jackie. I'm your caregiver for the day. I'm the one to feed your food. Is it okay for you, sir? Okay, may I know your name? Okay, what is your birthday? Okay. After verify the patient ID, elevate or adjust the bed 45-degree angle. After elevate or adjust the bed 45-degree angle, put the gloves. Assuming I wear the gloves already. Put the towel over the patient's chest. Put the towel here to avoid the wet. Ask the patient to open the mouth and check the back of the throat. This is to make sure that the tube is not coiled. Hi sir, can you open your mouth please? After checking the mouth, attach the syringe in the NGE tube feeding. Check or aspirate the residual tube feeding into the patient's stomach. Check if it's the right position. After aspirate, hold the syringe in 18 inches above the patient's stomach. After put the feeding formula, you must be fold. Pour the feeding formula with 30 to 60 ml at the time. Ensure the syringe is not empty during the feeding to prevent the gastric reflux. After the 30 to 60 ml, next one is the final flushing 30 ml of water. Medication is in the middle of the feeding. Check the feeding. Check the patient response of feed after feeding. After response the patient after the feeding, the patient should remain seated at least 1 hour to prevent gastric reflux. And then, like this. Clear all the things has been used for feeding. After clear the things, perform hand hygiene. Assuming that I wash my hand already. Document the patient chart. This is the NG tube feeding procedure. We'll show you the PEG tube feeding procedure. First thing to do is perform hand hygiene. Assuming that I already washed my hand. Introduce yourself into your patient and check the patient identified. Hi sir, I'm Jackie, your caregiver for today. I'm the one to feed your food. Is okay for you, sir? Okay. May I know your name? Okay, what is your birthday? Okay, after verify the patient, check the feeding order. Adjust the bed of 30 angle of degree if necessary. Elevated bed of a higher angle for comfortable working position. Example, assuming that I already elevate my patient. Check the patient and ask when was the last bowel. Hi sir, when your last bowel? Okay. After checking the last bowel, document document chart when the last bowel. Position the patient is semi or polar position or sitting position. Check the patient if it's okay or comfortable before starting the feeding procedure. Wear the gloves, assuming that I wear the gloves. Place the towel in the abdomen to protect patient food any liquid dropping. While putting the towel, check if any redness or infection. And then if in case any red or infection, and then put on the documentary chart. After putting the towel, open the tube and attach the catheter tip of syringe. Aspirate residual from the patient's stomach. After aspirate, attach the syringe and pour 30 ml of water. Fold the tube to avoid administered air in the stomach. Must be fold the tube. Assuming that I'm in a proper position to feeding the tube. After pour the water, pour any feeding formula or any medication. And then open. Flush the tube of 60 ml of water and close tubing. After putting the 60 ml of water, check the patient response after feeding. Sir, if the patient is okay, clear or discharge of any equipments to use for feeding and cover the patient abdomen. After cover the patient abdomen, let the patient in lower position within 30 minutes. And then after that, wash your hand. assuming that I wash my hand. Document the patient chart as the following. After leaving your patient, must be sure if your patient is okay or comfortable. This is the feeding, PEG tube feeding procedure.